Seniors, what your calcium score heart scan really means. So you did it. You had the heart scan. It was quick, pretty painless, and you just had to lie still for a few minutes. And now you have a number, a coronary artery calcium score. It's just a number on a page, but man, it can feel heavy. It's supposed to be a window into your heart's future, but for many of us, that window is foggy, confusing, and maybe a little scary. It is completely natural to feel anxious about this. What does this number mean for your cookouts, your vacations, your time with the grandkids? Does a high score mean a heart attack is just around the corner? That uncertainty can be a heavy weight to carry. Well, in the next few minutes, we're going to wipe that fog away and lift that weight. We'll take the confusion and fear out of that number. I'm going to show you exactly what your score means, and more importantly, the clear, simple steps you can start taking right now to protect your heart for the long haul. Think of this number not as a final verdict, but as an early warning, a head start even. It gives you the incredible opportunity to take control of your health and live that long, vital life you deserve. Let's start by breaking down what this score is actually measuring. What is a calcium score? So what exactly is a coronary calcium score? It comes from a special kind of CT scan that takes pictures of the arteries feeding your heart. Over our lives, gunk called plaque can build up in these arteries. It's a mix of cholesterol, fats, and other stuff. When that plaque hardens or calcifies, the scan can see it. Your score, which is often called an Agatston score, simply measures the total amount of this hardened, calcified plaque. Now, it's important to understand that the calcium itself isn't the main enemy here. The real danger often comes from the soft, non-calcified, waxy parts of the plaque, which are more likely to break open and cause a heart attack. The calcium is just a marker. It's like seeing smoke in the distance. The smoke isn't the fire, but it tells you a fire is burning. In the same way, the calcium score tells us that the process of atherosclerosis, or hardening of the arteries, is happening. The more calcium the scan finds, the more plaque is likely hiding in your arteries. This whole process happens slowly, over decades, and your score is a snapshot of how much has built up over a lifetime. This scan is an amazing predictive tool. It's not diagnosing a blockage you have right this second, and it can't tell you if you're about to have a heart attack. What it does is give you and your doctor a very accurate picture of your future risk, which allows you to be proactive instead of reactive. It's about giving you the power to make informed choices. So what do the numbers mean? All right, let's get to it. What do these numbers actually mean? The scores are generally broken down into a few key categories. And remember, these aren't just numbers. They are signposts that help you and your doctor figure out the road ahead. First up, a score of 0. This is the best possible result, the gold star. A score of 0 means no detectable calcified plaque was found in your heart's arteries. This points to a very low risk of having a heart attack in the near future. Research shows that even as we get older, a score of 0 is a powerful sign of excellent survival and very low risk. It's a huge sigh of relief. But it's not a free pass. It just means whatever you're doing is working, so keep it up and stay focused on a heart-healthy lifestyle. Next, a score from 1 to 99. This is considered mild plaque buildup. It confirms that a small amount of plaque is there. While your short-term risk is still pretty low, this number is your heart's check engine light. It's telling you that the process of atherosclerosis has started. Now is the perfect time to get serious about prevention and make those positive lifestyle changes to keep more plaque from building up. Then we have a score from 100 to 399. This indicates a moderate amount of plaque, and it's a significant marker. A score in this range, especially over 100, puts you on notice. Studies show it's linked with a notably higher risk of a heart attack over the next decade. This number tells you and your doctor that it's time for a more assertive game plan. We're moving beyond just prevention and into active management of your heart disease risk. Finally, a score of 400 or higher. This is considered extensive plaque buildup and points to a high risk of severe heart disease. Now, this is a critical point. A high score tells you there's a lot of plaque, but it does not automatically mean you have a dangerous blockage that's limiting blood flow right now. Many people with high scores don't have a significant obstruction. Still, this score is a serious call to action. It means you and your doctor need to work together on an aggressive plan to lower your risk. It might sound scary, but knowing is always better than not knowing. This knowledge gives you the power to act. And there's a special note for those of us over 75. As we age, having some calcification is more common. In fact, most people over 75 will have a score of 100 even without any heart disease symptoms. This means a high number in an older person might not carry the exact same weight as it does in a 50-year-old. But a score of 0 is still a fantastic sign at any age. The key is to talk about your specific number with your doctor in the context of your overall health.
I know this can feel like a lot to take in, but understanding is the first step to taking control. If you're finding this breakdown helpful and want to keep learning how to take charge of your health, do me a quick favor and hit that subscribe button. We're here to bring you clear, no-nonsense health information every single week. Now what? Your action plan for each score. This is where you take the driver's seat. You have your number, so what now? Let's build a clear action plan for each score. If your score is 0, congratulations, that's fantastic news. Your mission is simple. Keep doing what you're doing. This means staying on top of the pillars of a heart-healthy life. Keep up a balanced diet, get regular physical activity, don't smoke, manage your stress, and get good sleep. Based on this score, you and your doctor will likely agree that you can skip preventative medications like statins. Your job is to protect that perfect score for as long as possible. If your score is 1 to 99, this is your wake-up call to action. The disease process has begun, but you have a huge opportunity to slow it way down. Your main focus should be on intensive lifestyle changes. 1. Diet. This is non-negotiable. Zero in on a heart-healthy eating plan like the Mediterranean diet. That means lots of fruits, veggies, whole grains, and lean proteins like fish. You'll also need to cut back on saturated fats from processed meats and full-fat dairy. 2. Exercise. Shoot for at least 150 minutes of moderate intensity exercise, like a brisk walk, a swim, or a bike ride every week. Exercise makes your heart stronger and helps with weight, blood pressure, and cholesterol. 3. Stop smoking. If you smoke, quitting is the single most powerful thing you can do for your heart. It directly damages your arteries and puts plaque building into overdrive. You and your doctor will also talk about medication. Depending on your other risk factors, like high cholesterol or blood pressure, the 2018 ACC-AHA guidelines suggest considering a statin, especially if you're over 55. If your score is 100 to 399, okay, now we're shifting from prevention to active management. All those lifestyle changes we just talked about, they are now absolutely essential, but your doctor will likely bring up more direct medical therapies. 1. Medication is on the table. Guidelines provide a strong rationale for starting statin therapy for anyone with a score of 100 or higher. Statins are proven to lower LDL, or bad cholesterol, a major ingredient in plaque. They also help stabilize the plaque you have, making it less likely to cause trouble. Your doctor might also bring up daily low-dose aspirin. 2. Aggressively control other risks. If you have high blood pressure or diabetes, getting these under tight control is critical. That means taking your meds as prescribed and working closely with your doctor. 3. Further discussion. Your doctor will have a detailed talk about your specific risk and may set clear goals for your cholesterol levels. If your score is 400 or higher, a score this high demands an aggressive, all-hands-on-deck plan. You are at high risk, and the goal is to slash that risk as much as humanly possible. 1. Intensive medical therapy. You will almost certainly be prescribed a high-intensity statin to get your cholesterol down significantly. Newer guidelines even set very low LDL targets for people with high scores. Other medications, like blood pressure drugs or ezetimibe, might be added to your team. 2. Consider further testing. With a score over 400, your doctor may suggest a stress test. This checks if the plaque is actually limiting blood flow to your heart, especially when you're active. In some cases, or if you have symptoms like chest pain, more advanced imaging might be discussed to get a direct look at your arteries. 3. Embrace a new lifestyle. This is the moment to fully commit to a heart-healthy lifestyle as the foundation of your treatment. This includes all the diet and exercise changes we've discussed. Programs like cardiac rehab can offer fantastic, structured support to help you make these vital changes stick. And remember, no matter your score, you can't reverse the calcium that's already there. The goal of all these plans, lifestyle and medication, is to slow or stop the disease from getting worse, stabilize the plaque you have, and prevent a future heart attack or stroke. Your calcium score is not your destiny. It's your data. It's a powerful piece of information that gives you a peek into your cardiovascular future. Whether your score is 0 or over 1,000, the message is exactly the same. You have the power to influence what happens next. A low score gives you the confidence to continue the healthy habits that are protecting you. A high score gives you the urgent knowledge you need to make life-saving changes. Take this number, this new knowledge, and have a real, honest conversation with your doctor. Create a personalized plan together. Focus on the things that truly move the needle for a long, healthy life. Managing your blood pressure, cholesterol, and blood sugar, staying active and eating well, getting good sleep, and managing stress, and staying connected with the people you love. You've been given a crucial piece of information. Use it wisely. Use it to take charge of your health, to protect that incredible heart of yours, and to plan for a long, healthy, and vibrant future. For more in-depth information, I encourage you to watch our next video on the specific dietary changes that can make the biggest difference for your heart health. And as always, share your questions and experiences in the comments below. Your journey can absolutely inspire and help others.